Hi, I'm Adeline. I'm 16 and a grade 11 at the International School of Frankfurt. I'm from the USA.
Hi, my name's Sophia. I'm 18. I'm from Mexico and I'm a senior student at ISF.
We are here on behalf of the AIWC Health Charity Program working with the Markus Krankenhaus. This project mainly focuses on the psychological aspect of patients with IBD to try and improve their overall well-being. But what is IBD?
Well, IBD stands for irritable bowel disease, and it's actually an umbrella term for two different diseases, Crohn's disease and ulcerative colitis. Now, both of these diseases affect the large intestine and the rectum, and they can cause things like diarrhea,
Fatigue and weight loss?
yes, and can even increase the risk of cancer. This illness is a lifelong disease, and often young adults are diagnosed from ages 15 to 35, and they have to deal with it for the rest of their lives. Currently, there are about 400,000 cases in Germany.
Today, we are honored to be able to talk to Dr. Claudia Gutmann, the leader of the psychological treatment of IBD.
Of course, since we're in a pandemic, the interview will be conducted via Zoom. So, let's begin.
Hi.
Hi.
So who is Sophia and who is Adeline?
Okay, so I'm Sophia. And I'm Adeline. Thank you so much for joining us. Okay.
I have to thank.
We know about this project through the AIWC, who started supporting the team about a year ago.
Yeah.
We'd like to conduct this interview to bring more awareness to your cause.
Yeah.
And in this interview, we will be asking you about your project, your patients, your team, and then also how we can assist you with fundraising.
Yeah, that would be great.
Yeah. Could you please give us a brief introduction of yourself, a little bit about the project, and also what inspired you to start this project?
Yes. My name is Claudia Gutmann and I'm 51 years old. I live in Bad Vilbel with my family and I'm a psychologist since over 20 years. And I always work with people with cancer first. So actually, I am the head of the psycho-oncology in the Markus Krankenhaus in Frankfurt, Main. We had the problem that our medical colleagues in the hospital often ask us if we can support the young patients with inflammatory bowel disease too. Our job is only to support the cancer people, but our colleagues ask if we can come to the other young patients too. So a couple of years we said, okay, we have to care about them. We have to get money to take care of these young people and their families too. That was the beginning.
Why do you think that the psychological treatment is especially important for the teenagers and young adults?
Yeah, it's a special situation for them because with 18 and 16 you fall in love, and in a couple of years you want to leave your home, you plan your job, and it's a very special phase. It's very special time, and that's a problem. There's no space for such a sickness, and it's very, very difficult for them to accept the inflammatory bowel disease. The young people, they always move between to avoid the sickness and sometimes they go to the other side and they are confronted and they get depressive, and it goes like this. And our job is to try to keep them in the middle, to see, okay, I have to accept the illness and at the same time I can live my life. It's possible. We have 1,000 patients every year in Markus Hospital, and in whole Germany we have 400,000 young people between between 15 and 35 who have to live with these symptoms every day.
So about the patients, how often do you meet with patients, and how many hours do you talk with each patient per week?
Yeah. Okay. It depends how long they stay in the hospital. We have patients, they leave about after a couple of days, and we have patients with very big resections and problems after the resections who stay 3 weeks and longer. But most of our patients we meet 1 to 3 times, and often this is enough. And if we have patients who have more problems before their diagnosis or on top the diagnosis, we can see them more often, and then we look for psychotherapeutic help if they are outpatient again.
Dr. Claudia, would you mind sharing with us a patient that you noticed a special change in?
Yes, I can talk about a young woman who had the problem. She didn't want to know the other people in her class that she has to go to the toilet, and she had a lot of stress in school every day. And we talked about how she can talk about her illness without shame and without, oh, I don't want to have it. And we it was like role playing. We just thought about what can she say, what is okay for her to let the others know, and what are themes she doesn't want to talk about it. And a couple of weeks later we phoned, and she told me that she managed it, and it was the first time in school that she talked about her illness. It is one example. So she had less stress in school.
That's great. That's a great change.
Yeah.
IBD isn't a terminal illness, so I mean, it isn't the same as having cancer, of course, but
No.
I'm sure that they have like other struggles, like different ones that would only affect them and their kind of illness. Could you talk a little bit about that?
Okay. So it is the illness is not curable. That is a problem. It's a chronic illness, and a lot of them have symptoms in about every 4 months, or sometimes they feel good about 5 years, and then the illness is back. So it depends. It's different. And they need treatment. Most of them have medical treatment who causes other somatic problems too, and a lot of them have resections. Resections, and sometimes a stomy. They have to live with a stomy. So they have a lot of problems on account of the medical treatment, which they need. Yeah.
How do you determine how much help a patient needs, and also when they need the help that you give?
So we get the information from our medical colleagues, and then we go there in the room where they are in the bed and speak to them. And then we ask the patients, what kind of help do you need? What things do you want to speak about? So most of the time, the patient decides how long we speak together, and we say okay. We say we think what we recommend to.
Now I'd like to ask about your team. So exactly what kind of people are on your team? As in, are there both men and women? Do they speak different languages maybe? Past qualifications? Do they have had work with chronically ill patients in the past?
Yeah. My team, yes, we are 6 women only, and we are all German. We are not multicultural in our team, but a lot of us speak English, because we have patients from other countries in Markus Krankenhaus too. And all of them, yeah, the youngest is about 31, I think, and we are up to 55. And all of them, yeah, they are specialized to work with somatic ill people.
Next questions I have for you is about mainly the fundraising aspect of your project that you have. When you give donations or when you receive donations, how are those used towards your program?
Yes. We started last year with our project, and we first got money from the American International Women's Club and from different Rotary clubs. And we paid a salary for one colleague who speaks with the patients. Because in Germany, like in other countries, we have no insurance who pay this counseling in a hospital. We have only for outpatient patients we have an insurance, but not for psychotherapeutic help in the hospital, and that's a problem. So we try to get more awareness for this illness, like for cancer. Too, we have in Germany, we have very good counseling centers, especially for people with cancer, but we have no centers for other illnesses, and that's a problem. And the people need the help first in the hospital, where they are very weak, where they have a lot of pain. So we want to get the money for salaries so that we have money for another year. The perspective is that we get money from our hospital too, or for an insurance. And yes, we need about 50,000 money a year for approximately 10 hours counseling a week. And it would be great if the American International Women's Club can give us another part of these 15,000 euros for the second project year.
Just overall, is there anything else that you would like to share with us?
Yes, I'm very happy that there are 2 young women like you who are engaged in social projects like others. It's very good to know. I'm very thankful for this interview.
Thank you so much for watching.
We hope you learned something new, because we sure did. If you would like to know more information, refer down below for more questions and answers.
Again, thank you so much for supporting us and the AIWC's charity project. We hope you have a wonderful day. Bye!